This is Karen with NewClevelandRadio.net, and it is time for Care Notes with Doug Wilbur. Welcome, Doug.
Hi, I'm coming here today actually to talk about um, some of the findings that we have right now for COVID, and to update people and specifically to give some direction that I believe will help prevent the spread of COVID with our caregivers, protecting both our caregivers and our clients as well. I have Molly Patel, who is our nurse manager here. Molly has an extremely good background in infection control because she worked in the ICU at the Cleveland Clinic for, I believe, around 16, 17 years, if I remember right, Molly. Is that about right?
Yeah, 18 years total, yeah.
Okay, a lot of experience, we'll say that much. The big thing that I want to first introduce with is the problem. And the problem is right now is, and people have seen the news reports that COVID in this area has grown to be a really big problem, such a big problem that we're approaching in most of the counties that we serve level 4, which is the highest level and risk that is the classification in Ohio. Now, what that basically indicates is that we have to essentially assume that every person that we meet has COVID, whether that be a family member, whether that be a client that we're serving, or a client's family member, or someone that we pass in a drugstore, or a restaurant that we're getting takeout with. And so for that reason, we need to start really taking very special precautions. And so the purpose of this time is to allow Molly to give some instruction to our caregivers. And this is very, very important. We highly, highly, highly recommend that you follow the ideas and the guidelines that we're doing very closely. So Molly, I painted the problem that is there. And now, hopefully you can provide some of the solutions to make people as safe as we possibly can be under the circumstances.
Right, yeah, so absolutely, many of the counties that we serve are now, like you said, approaching level 4 caution as far as the spread of COVID, which just means that level 4, we're no longer able to track and trace where COVID is coming from. It's spreading so quickly. And so, like you said, we need to assume that pretty much anybody we take care of could be carrying the virus or could have the virus. And as a result, we want to just be very careful to mitigate those risks of exposure for ourselves and for our clients. And
I'll just mention one other thing, and this is kind of a hard thing psychologically to do, because oftentimes we're not feeling bad, but we have to assume that even if we're not feeling bad, that we are carriers. And that's really important, because that's, I think, one of the missing links in people's mindsets with this,
Right.
that I may, even if I'm feeling fine right now, I may accidentally be a carrier, and not only because they're silent carriers, but also because the fact is the symptoms don't always show up immediately, even when you are carrying something and have that load going on. So I'm sorry for interrupting, but I think that's really important.
Yeah, very important for people to know too that in some cases, people are getting very, very mild symptoms that seems like just a cold. And it's easy to sort of be in denial and say, oh, it's just a cold. It couldn't possibly be COVID. And a lot of these people with just cold-like symptoms actually do end up being COVID positive. And kind of wish they had, taken steps to mitigate sooner. when someone does develop symptoms, they, before they develop symptoms, they're still contagious for the 48 hours beforehand. So you just don't know that you're contagious or not. So we have to assume, that we all could be, like you said, and take those precautions, protect our clients, our family members, but also, protect ourselves. And the protection goes both ways.
So what do we need to do?
Okay, so some of the things you can do to mitigate risk, reducing your exposure to other people. I know it's the time of year to have family gatherings and things like that, and go shopping, but as much as we're able to reduce that exposure to other people, then that will reduce your risk of being able to pick up COVID. The other thing, secondly, washing our hands for 30 seconds between the fingers, front and back, around on the wrists for a full 30 seconds with soap and water. It doesn't have to be antibacterial soap. It can be any kind of soap. And that is a really big preventer in the spread of disease.
And if I understand things right, this virus is very, very susceptible to soap. In other words, soap kills it. You just have to use the soap.
Right,
so,
right.
Yeah.
You don't need bleach to kill it. You just need soap and water. So it's the outside of the virus is made up of a fat capsule, and any surfactant that will, cut fat will, will break that apart and render it ineffective to be able to spread. The third thing that we want to do is, and what we're recommending now, is to wear a special mask that is called a respirator, either an N95 or a KN95. These respirators will filter out 95% of the particles in the air. These are the kind of respirators or masks that we're using on the front lines for people working in the hospitals. And I'll show you what KN95 looks like. This is one's all folded up. This is the inside, and with a nose piece on top, and it fits around the ears. I'll demonstrate how to use that in a moment. And this is an N95. They come in different styles, different models, but this is basically what it is. The whole point of both of these is to fit snugly around your face so that you're actually breathing through that filter of the mask, and it's not, you're not taking in air from around the edges. That way.
So if you feel the air coming in the edges, that's actually means that it really isn't probably a tight enough fit.
Right. Right. The fourth thing that we can do to mitigate risk is to monitor ourselves, our household members, and our clients for any kind of symptoms. That may be fever, but a lot of people don't have fever. Cold-like symptoms, like when you're catching a cold. Gastrointestinal symptoms like loose stool, diarrhea, nausea, vomiting, or neurological symptoms like headaches, dizziness, fatigue, numbness and tingling, those sorts of symptoms. And those are the kind of the big symptoms that we're looking for. Another big symptom is about 30% of people will get a loss of sense of smell or taste, or things will smell or taste off. They just won't taste like normal. But that's only about a third of people, so you can't assume if you have a cold and you haven't lost your sense of smell that you don't have COVID, because you may have it. So, and then I would like me to demonstrate how to put the KN95 on. Now this is the one we are providing for all of our staff. We would like them to have. We're giving this out from the office. It's available in our storage bag. It's like a little paper lunch bag, and it has a place for your name and the date on here. These are reusable as long as they're not wet, soiled, or torn. And that CDC.
So you mean the bags are not the bags, but the masks are reusable.
Yes,
not,
these are reusable. You store them in the paper bag. The paper bag is for allowing the condensation that has built up on the inside from use to dry out. That's why we don't have a plastic bag for it, because they need to dry out. Once they're dried out in their paper bag, you know, the next day it's good for the next shift. But I'll show you how to put this on. You always want to have clean, washed hands before you start. And then open it up so you can see in the nose piece on the top, there's a little metal piece in there, and you want to put that on your face. Put the earpieces on around your ears, and then form the nose piece so that it fits onto your nose nice and snug. And then you want to take in a deep breath and out, and make sure that you're not leaking a bunch of air around the edges, okay, as much as possible. So you can also, if you want to tighten it up a little bit, put a little bit of a knot in the earpiece if they're not tight enough, and make it the earpiece a little bit shorter. Because mine is a little bit loose. You put that around your ears like that. Get your hair out of the way and tighten this up. Now it has a nice snug fit. I can feel that the air is not going out around the edges, but rather I'm breathing through the filter of the mask, and that's the goal that you want to have. Okay.
Yeah, you can actually see as you breathe, it's going in and out.
Yeah.
So.
And a similar thing for the N95. They tend to be a little bit more like stiffer or formed. What you want to do is put the straps around your hands so that they're hanging down, and then you fit it to your face. You put the top strap like on the back of your head above your ears. Sorry about my bad hair day here. And then the bottom strap goes behind on the back of your neck. Okay, and then you do the same thing. You form the nose piece so it's nice and tight. Make sure that you can adjust these straps. I usually wear a ponytail, and I'll put this top one over top of the top of my ponytail, and it stays in place better that way. For those of you that use ponytails. And then the same thing, you want to make sure you breathe in and out, and you're not leaking air around the edges. Okay. And the other thing that we're using, particularly, can you hear me okay?
Yes, we can.
Okay. Particularly if there's a risk of being splashed, if you are, doing certain kinds of bathing care or,
Personal
toileting.
care.
Yeah, personal care, and there's a possibility of being splashed. You don't want to get splashed in your eyes. There's goggles that we are providing as well. You can put those on. This will protect your eyes from getting any splatter. Or you can use the face shield as well. The face shield has a little foam piece on the top and like this rubber piece that goes around your head. You just put that on your forehead, and the rubber piece fits around this. You can see through this. You can wear your glasses under this if you have prescription glasses and you need to see, like me. Can you hear what I'm saying?
Yes.
Yep.
Okay. And that way, if you have splatter coming at you when you're providing care, that's going to protect your face and your eyes from getting any splatter. We ask, my recommendation, and obviously, this is not a mandate for people, but it's meant to be a protection for all of our caregivers. We recommend that you wear your either N95 or your KN95 for 100% of your shift. If you need to take a break to eat or get some fresh air, then I suggest, if you're able to, go outside in your car or away from the assignment and take 15 minutes, get some fresh air, eat your lunch. Always, when you put this back on, you want to assume that this could be contaminated on the outside, So if you're putting it on and you touch this, make sure you sanitize your hands before you touch your eyes or your food or anything like that. But to take it off, put your hand back on the front, and these go over your head, very messy hair, okay? And then you take it off like that, and then you just store this in your paper bag. And that, once that condensation dries out, you're safe to use that again. Any questions there about that demonstration?
So one of the things that I, obviously am concerned with is how much does this help? Like, in other words, if you were to wear this, is it really going to be that much different from wearing a cloth mask or the surgical mask? And I think if people understand the difference it makes wearing something that is a little bit more, might feel to some people a little bit more constricting, makes them feel differently. And I think a part of that one is, and maybe I'll state one thing that people don't oftentimes remember, is when we wear a mask, it only slightly, like the standard mask, it only slightly protects us. Really, the purpose of the mask is to protect others.
Yeah.
From our germs. And it's the other person wearing a mask that protects us from their germs. But wearing this mask protects us from giving germs, but also from getting germs in that situation. Right. So does it really substantially make a difference?
It does make a difference. The simple masks that we're wearing, as either patients or caregivers, this is called source control. And like you said, it keeps the droplets from going out into the air to other people in the room. But source control, as you can see, there's gaps here. You're breathing in the air. It's not getting filtered when it comes around those edges. Source control we use that all the time in the hospital for procedures or for the operating room. It's meant to protect, that sterile field that we're working with. Just as you assume like the patient that you're working with is your sterile field, you want to protect that patient from getting any of your droplets. That's what source control is for. And that's what we've been using up to this point for the most part. The KN95s or the N95s, both of these are considered airborne protection. This is what people in the ICU or the COVID wards are wearing to filter out the air so that they can breathe safely without getting exposed. So
it gives a really high level of protection.
Yes.
I mean, a tremendous.
Yes.
So that's great.
Right. And to give you an example, we had one client that we were taking, or it was a husband and wife client we were caring for, and we were suspicious they had an exposure. We were worried about them developing symptoms, and we did have the caregiver that was in there, wear this kind of protection, N95, KN95, as well as, in that case, we had her wearing a gown as eye protection as well. Unfortunately, the clients did develop symptoms, and she was with them the whole day that they developed symptoms. She didn't really realize until later in the afternoon that they could be really getting sick. And then for 48 hours before they developed symptoms, they had still been contagious while she was caring for them. We put that caregiver in isolation, and she did her whole quarantine. She never developed any symptoms. She never got sick. She tested negative for her COVID test, and it was all because she was wearing that airborne protection, and that's the whole point of it.
So there really is a big reason why this is a huge advantage for our caregivers,
right.
In that possibility, small or large, that the person that, you're dealing with develops, or someone coming in were to develop it. But part of it is you really need to wear this throughout your shift. correct. I mean, that's
Right. Yeah, and I know that can be, difficult to get used to, particularly if you haven't done it before. I've done it myself for 12-hour shifts. I know how hard it can be wearing the full Airborne, like the gown, the respirator, the face shield, the gloves, everything. Those are kind of extreme cases. But when you see how much protection that can provide, I would say, I feel like it's well worth it. I myself, I have, I can wear a respirator. I have a heart condition and I can still wear my respirator. At this point with my age and my heart condition, I might limit that to about 3 or 4 hours. I know people find it more difficult to breathe through, but it really is a matter of getting used to breathing through it, not so much of any kind of loss of oxygenation or anything like that. Your oxygen levels, will not drop just from wearing a respirator.
So a couple other things. You were talking about source control. Obviously most of our clients aren't going to be wearing a respirator, but a lot of them probably could wear a mask, a just standard mask. And that also can make a difference if they're willing to do that. And so is that something you would recommend that they would do if they're open to the idea, or if they don't have dementia where, it would be difficult for them to keep it on?
Yeah, I would recommend that, and primarily because that's what our health department is recommending. In some cases it's difficult for our clients, like you said, like who have dementia, where it might send them into a panic, and we don't want to panic people. But if it's something that they're amenable to, if they're able to do that without getting more confused or panicky, that source control would be important to protect, everybody involved.
What if I have to eat or drink? What do we do in those situations? I know that's probably that goes through the mind of some of the caregivers.
Oh, for the caregivers, or yeah.
Yeah, for the caregivers.
Right. If you're wearing your KN95 and you have to take your lunch break, and I know in some specific cases it may be more difficult with patients that are really highly needy, as far as your attention and time. But if it's possible to take that lunch break in a separate room, with totally different room than your client, try to make it a short lunch break, like 10-15 minutes, eat your lunch, or part of your lunch, make sure your food gets covered up. That will reduce your exposure risk in the event that one of your clients is unknowingly carrying the virus. My other suggestion is, if you're able to go out to your car and eat, go ahead and go out to your car and eat. If the patient is not safe doing so, then do it to a separate room, and something like that. And the shorter time you have with your respirator off, the less exposure time you have, and time really does make a difference as far as the viral load that people get. The higher the viral load that you get, the more likely it is that you will get sick. And so reducing that exposure to viral load is the key.
I think one of the, in finishing up, and do want to finish up quickly, but this isn't meant to be a panic thing. This is really meant to be a solution thing.
Mm-hmm.
We are doing care, and what we're trying to do, I believe, with these steps is to keep our caregivers and our clients as safe as possible. It makes a huge difference. It even makes a difference on how the health department classifies, even when someone gets exposed, if they're wearing the thing, the KN95s or N95s. It's a whole different ball game. So it is to everyone's advantage to do it, in that case. And so we really want to do what's right for our clients, and we really want to do what's right for our caregivers, and that's why we as a company are providing this. And how do people get these? You know, obviously we have them at the office, and so what do they need to do?
You know, just they can either give us a call or send us an email that, you know, what time or when they would like to come pick one up at the office. In some cases, you know, we can mail them out to people if, you know, if it's a far drive or whatever. You know, and then this is what they'll get. And we also have face shields as well, or goggles that we can give to people. Yeah.
Perfect. Well, I really appreciate the time that you took to explain this, Molly, and I really believe our staff is going to see the value in this. And so, you know, again, I highly recommend that people follow the steps very, very closely. Make sure you do all the things, including the self-monitoring, and I believe that it'll keep people safe. So that's it.
Well, I hope everybody takes care. And like Molly said, don't forget, wear your mask and wash your hands. Have a great day, everybody.